Turns out, vaccine hesitancy in autism. There's a belief that's quietly reshaping which families vaccinate their kids, and it's rooted in something that's been scientifically dead for decades. Parents of children with autism are significantly more likely to refuse or delay vaccines for their other kids. Not because they learned something new, because they're afraid the vaccines caused the autism in the first place. And here's the thing that keeps epidemiologists awake at night: that link was never real. So what happens when a medical myth becomes a behavior? What if parents aren't choosing hesitancy out of ignorance, but out of desperate logic built on a lie? Before we dive in, let's set the stage. For over 2 decades, a debunked study claimed the MMR vaccine caused autism. That study was fraudulent. Its author lost his medical license. Every major health organization on Earth says vaccines don't cause autism. But the idea metastasized anyway. It lives in Reddit threads and Facebook groups and the quiet conversations between parents at pediatrician offices. What researchers wanted to know was whether this specific myth actually changes how parents behave when they're raising a second child. Does the diagnosis itself trigger vaccine hesitancy? And if so, how common is it really? This study comes from researchers at Health Sciences University in Izmir, Turkey. Kara-Aksay, Özyurt and their team spent months doing the unglamorous work that doesn't make headlines. They asked parents directly about their vaccination choices. They published in the European Journal of Pediatrics in June 2026. What they were about to uncover was both expected and deeply troubling. Here's how they did it. Over 3 months, every parent who brought a child with autism spectrum disorder or other developmental delays to 2 large hospital clinics got a questionnaire. 154 parents total. These weren't abstract interview subjects. These were real people sitting in waiting rooms, trying to figure out how to help their kids. The questionnaire was ingeniously simple, but powerful. It asked parents what they did before their child's diagnosis, what they did after, and critically, what they believed vaccines could or couldn't do. The researchers used Likert scale questions, basically asking people to agree or disagree with statements about vaccine safety. This let them measure not just behavior, but actual belief conviction. Now the results. First, the baseline. Before diagnosis, vaccination rates were normal. Parents vaccinated on schedule, trusted their pediatricians, moved forward. Then diagnosis happened, and things shifted. After diagnosis, approximately 44% of parents reported changes in their vaccination behavior. Some delayed vaccines. Some skipped them entirely. Some decided not to vaccinate any future children at all. To put that in human terms, nearly half the parents in this study altered a major health decision based on a diagnosis that had nothing to do with vaccine safety. That's not a small statistical signal, that's a rupture in parental decision-making. But here's what gets more specific and more concerning. Parents with children diagnosed with autism spectrum disorder showed higher hesitancy rates than parents of children with other developmental delays. This matters because it suggests the autism vaccine myth is doing something particular to autism specifically. It's not that developmental diagnosis triggers caution in general, it's that autism does something sharper to parental confidence. When asked directly, parents cited beliefs that vaccines might have caused or worsened their child's autism. Some expressed concern that further vaccines could harm their other children. The study measured these beliefs numerically, and parents with autism-diagnosed children scored significantly higher on vaccine hesitancy scales. This wasn't ambivalence. This was conviction. These parents weren't fence-sitting. They were making deliberate choices based on a false causation they'd absorbed from somewhere in their information ecosystem. What does this actually mean in real life? It means unvaccinated kids in families that already have medical complexity. Kids with autism often have sensory sensitivities, GI issues, immune complications. Adding preventable diseases on top of that existing burden is almost incomprehensibly cruel. It means when these unvaccinated kids get measles or pertussis, the whole family suffers longer and harder. It means outbreaks can trace back to clusters of hesitant families. Now here's where we need to be honest about limitations. This is Turkish data from a specific region. The rates might be higher or lower elsewhere. And critically, this is self-reported behavior and belief. People don't always tell the truth to researchers, especially about medical decisions they might feel judged for. We don't know if parents actually followed through with the vaccine refusals they reported, or if they said one thing in a questionnaire and did another at the clinic. That gap between stated intention and actual behavior matters enormously. Also, the study doesn't explain causation. We know hesitancy increased after diagnosis, but we don't know if the diagnosis itself caused the hesitancy or if parents who were already skeptical were more likely to seek autism diagnosis explanations. Zoom out for a second. What this study does is nail down something epidemiologists have suspected. The autism vaccine myth doesn't just live in headlines and conspiracy corners. It lives inside families making real healthcare choices. It lives inside the particular vulnerability of new diagnosis, when parents are desperate for explanations and scared. Most vaccines don't cause autism. Autism has genetic and developmental origins that were happening in utero years before any vaccine arrived. Scientists have tested this claim hundreds of times across millions of children. It doesn't hold. But here's the harder part. The original fraudulent study that started this came from medical authority. It was published in a major journal. It had a doctor's credibility attached. And even though it's been thoroughly debunked, the idea survived the evidence. It found a home in the emotional landscape of parents who were grieving a diagnosis and searching for something to blame. The big unanswered question now is, how do we actually change minds that were formed in fear rather than evidence? Providing more facts clearly doesn't work. We've been doing that for 20 years, so what does? Here's what sticks with you. Nearly half of parents in this study changed their vaccination choices based on a medical myth that has been dead for 2 decades. Not because they're stupid, because they're scared. Because our brains believe things that explain pain more easily than things that don't. And because, if you're a parent looking at a developmental delay in your child, you need an answer. You need someone or something to blame. A vaccine is easier to blame than genetics. A single injection is easier to blame than the vast, chaotic complexity of human development. So the vaccine becomes the answer, even when it isn't the culprit. So here's the question that should be sitting in your head right now. If facts don't change minds formed in fear, what actually does? Turns out, scientists have been busy, and they're not done yet.